In this lesson, we are going to talk about dementia management. In our previous topics, we have talked on psychological and psychosocial therapies and medications. But now, today, we are going to talk about pain and eating difficulties as a management of dementia. And in our next classes, we will talk about exercise, assistive technology, alternative medicine, and palliative care as a way of management to dementia. Okay, now let's enjoy reading. On pain and eating difficulties. Pain. See also assessment in nonverbal patients and pain assessment in advanced dementia. As people age, they experience more health problems. Most health problems associated with aging carry a substantial burden of pain. Therefore, between 25% and 50% of older adults experience persistent pain. Seniors with dementia experience the same prevalence of conditions likely to cause pain as seniors without dementia. Pain is often overlooked in older adults and when screened for, is often poorly assessed, especially among those with dementia, since they become incapable of informing others of their pain. Beyond the issue of human care, unrelieved pain has functional implications. Persistent pain can lead to decreased ambulation, depressed mood, sleep disturbances, impaired appetite, and exacerbation of cognitive impairments, and pain-related interference with activity is a factor contributing to falls in the elderly. Although persistent pain in people with dementia is difficult to communicate, diagnose, and treat, failure to address persistent pain has profound functional, psychosocial, and quality of life implications for this vulnerable population. Health professionals often lack the skills and usually lack the time needed to recognize, accurately assess, and adequately monitor pain in people with dementia. Family members and friends can make a valuable contribution to the care of a person with dementia by learning to recognize and assess their pain. Educational resources and observational assessment tools are available. Eating difficulties. Persons with dementia may have difficulty eating. Whenever it is available as an option, the recommended response to eating problems is having a caregiver assist them. A secondary option for people who cannot swallow effectively is to consider gastrostomy feeding tube placement as a way to give nutrition. However, in bringing comfort and maintaining functional status while lowering risks of aspiration, pneumonia, and death, assistance with oral feeding is at least as good as tube feeding. Tube feeding is associated with agitation, increased use of physical and chemical restraints, worsening pressure ulcers. Tube feedings may cause fluid overload, diarrhea, abdominal pain, local complications, less human interaction, and may increase the risk of aspiration. Benefits in those with advanced dementia has not been shown. The risks of using tube feeding include hesitation, rejection by the person pulling out the tube, or otherwise physical or chemical immobilization to prevent them from doing this, or developing pressure ulcers. The procedure is directly related to 1% fatality rate with a 3% major complication rate. The percentage of people at end of life with dementia using feeding tubes in the US has dropped from 12% in 2000 to 6% as of 2014. The immediate and long-term effects of modifying the thickness of fluids for swallowing difficulties in people with dementia are not well known. While thickening foods may have an immediate positive effect on swallowing and improving oral intake, the long-term impact on the health of the person with dementia should also be considered. I'd like to repeat. The immediate and long-term effects of modifying and thickness of fluids for swallowing difficulties in people with dementia are not well known. While thickening fluids may have an immediate positive effect on swallowing and improving oral intake, the long-term impact on the health of the person with dementia should also be considered. Okay, that's all from today. On topic eating difficulties and pain management, and I do hope you have enjoyed listening to this video. And once again, I would always appreciate any endeavor from you to be a part of this channel, to subscribe to this channel, to like, to criticize, and to share. Okay, thank you very much, and I do hope you will continue keep commenting and keep sharing this. Thank you very much.